wellness revolution starts now.
Welcome to the program. My name is Bryana Burken, pharmacist and physician liaison with Physician's Preference Pharmacy. Thank you so much for joining us today. I'm so excited to be doing our first episode together. I'd like to introduce you to Bailie Muñoz. So she is actually our licensed esthetician at the Hotze Health and Wellness Center. You may have seen her before or had some lovely treatments done by her. She is also my esthetician, and I trust her with all the advice and information that she has.
Thank you.
And with my face. So today, of course, we're going to be talking about one of our compounded skincare products, but I wanted to bring in Bailie because I can talk about the ingredients of the cream all day that we're going to be discussing, which is the healthy skin cream. But I want her to unpack the why behind the formulation and for us to understand a little bit more about what it's actually doing at a cellular level. So we're going to be discussing a compound that we've been making probably for a couple years. It's called the Healthy Skin Cream. And we developed this one because we have so many different products on our formulary that are used for treatment, but we were getting some requests for prevention. Okay. So with the Healthy Skincare Cream, this is something that is supposed to be used more regularly and on a daily basis. So we know that a lot of skincare issues are inflammatory driven. Talk to us a little bit about what you're seeing just in general with people's skin, especially here because we have a lot of postmenopausal females, but we don't just see postmenopausal females, and we also see men, right? So what are you primarily seeing?
I am primarily seeing females, whether it be 30s, 40s, 50s, and our bodies are always in such different phases. So it's nice to have something that has some ingredients in it that can help with that broad range of menopausal, premenopausal, postmenopausal skin. Because anytime a guest comes into the office and it's aging or it's pigmentation or I woke up one morning and I have this one spot on my face, where did this come from? Is it hormonal? Everything goes back to inflammation and your skin barrier. So whether it's our hormones or our environment and everything is just so in sync together, it always leads back to an inflammatory response. And we all know that hormones and the skin is inflammatory.
Right. So I think you bring up a good point because it just shows how what you're doing as an esthetician plays in so closely with hormone replacement therapy.
So
if hormones are done right.
Yes.
Right?
Yes. If they're done correctly.
If they're done right.
Yes.
And also nothing that we do here is a quick fix, right? We didn't get hormone imbalanced overnight. People's skin, I imagine, didn't get inflamed overnight.
It did not.
But sometimes you get that pimple or you get something that shows up, like you said, what the heck? Where did it come from, right?
Yes.
I'm thinking about myself and some questions I've asked you in the past where it seems like it's out of nowhere, but I'll have excess oiliness, for example, right?
Right.
And obviously, especially as women, we know our skin. If we wear makeup, we're touching our skin every day. We're putting products on our skin every day. And even that oiliness can be a reflection of hormone imbalance, right?
Absolutely.
We talk about that stress.
Yes.
Like, can you talk a little bit about that, why that happens?
So in regard to the excess oiliness, correct? Our sebaceous glands are basically pre-programmed to produce a certain amount of sebum in the skin to keep our skin barrier balanced, intact, the integrity, protective to our bodies. Whenever our skin or our bodies experience inflammation and there is a inflammatory response that happens in the skin, there's swelling that happens along that inner lining of your pores. And when that happens, even the little, facial hairs cannot wick that oil up to the surface so that we can, keep that oil production normal. And then you produce abnormal oil production because there's so much swelling in the inner lining of that pore. And when that happens, that's whenever we start to see the oiliness, we see the shine, we see that our pores are holding on to more and more bacteria. This can also lead to someone saying, oh no, my skin is so oily, I need to use stronger ingredients that then strips the skin. Well, then that creates a barrier that becomes, not intact. Your barrier becomes disrupted. You're left to more, you're vulnerable to more bacteria being held in the pore. You can't, your cells can't turn over because sebum is sticky. It's like a glue. And we only need enough of that balance to protect our skin and then allow your, dead skin to shed. So it is truly a cascade. It is an inflammatory cascade that is happening in your skin when you're producing, too much oil. And then so many things can go wrong. That's why it's so important that you pick that you're very intentional about the ingredients that you choose to then put onto your skin to get everything back into balance. Just as your hormones are out of balance, you need to pick the correct form of hormone, the correct actual hormone, the dosage, everything. It's the same for your skin.
All about balance, right? I like the use word intentional. That's one of my favorite words because the way that we're taught, the way I was taught in pharmacy school, and I'm sure, your formal training, my formal training, it's kind of just like a check the box, symptom drug. And we need to be seeing every guest as an individual. Absolutely. It's not just, you have oily skin, do this. I come back to myself of what I was just talking about, the excess oil. We know in our personal lives when we're experiencing extra stress.
Yes.
What do we need to do about that? Sometimes we need extra hormone support, but also, I know you because you're a personal friend and you're my esthetician is, you know what's going on in my life, right? Are there extra stressors? It's not just like, hey, deal with the excess oil. Right. What's going on? Are your adrenal stress?
In that moment, it's 30, 60, even 90 days prior to you seeing the signs because, like you mentioned in the beginning, it takes time. It is not overnight. Our skin can react at the drop of a hat if we're maybe allergic to something or having a reaction, but oiliness is not a reaction. Oiliness is a response. So what are we responding to? What do we need to address? And then you've got the internal and then, your ingredients are the external. So you do have to treat it inside to out.
Right. A couple things I've learned from you specifically is one, because I know a lot of people might have like a blend of, I don't know what the appropriate word is, but a blend of the oiliness and the dryness.
You can have dry skin and then have oily areas of the face. What most commonly would be the T-zone specifically. This is where our pores tend to be tend to become more enlarged is in, the T-zone. But dryness and dehydration are two totally different things. And you can have dry skin and be dehydrated. And you can have dry skin and have excess oiliness. And almost like to treat oiliness as like it's a symptom of something and not even specifically a skin type. And that's very controversial. But if you treat oiliness as it is your skin type, I don't believe you will truly ever fix or achieve that balance as soon as you could, as if you treated it, okay, this is a symptom of something. What is happening?
For someone that tends to be more oily, it's the thought process is, well, let's dry out the skin.
Yes.
And I would imagine it's the same people that have dry skin. They want to almost, quote unquote, over moisturize. But I do know, as you have taught me, that it is the intention and the faithfulness to the regimen that you put in on a daily basis.
Yes.
And just like we don't give someone one prescription hormone, you don't recommend one product.
Right.
And it makes sense because there's different layers that you need to be applying and different types of nourishment you need to be bringing to the skin.
And then sometimes that product is only in your skincare regimen for a time being. And that can be difficult to accept. I buy skincare products myself. So whenever I'm purchasing something, I'm telling myself, okay, I am going to invest in this, but I'm not always going to have to use it. I'm using it to serve its purpose. And then I can go back to my, daily in my most intentional, ingredients that are to maintain. Sometimes we do have to accept, okay, I do need this one product for a certain amount of time. And then, once we get back into a balance, I'm going to maintain that balance.
Yeah, that's something that you really helped me do too, is that, when I first started working with you, of course, I came with my certain set of things that I loved in my regimen.
You did.
You slapped me on the hand where you said, get those out. So
we just need to tweak a little bit.
I resisted at first, but I listened to you because I trust you. So I got some of those things out of my regimen and then also added some other things in. And so some of those products come from the vitamin store. Some, of course, are your treatments, which are awesome, your laser treatments, which I love. And then also, the nourishment that you're getting in the lifestyle is all really important. That's part of the whole thing around keeping it intentional. Like you said, sometimes we have to layer certain things in. They're only in there for a certain amount of time. And so that's how we keep intentionality around the regimen, just like we would with vitamins or hormones.
Yes.
What you're going to need today or for the next 5.5 years, you might not need in 10 years. It might even be shorter course than that. So I want to talk about the healthy skin cream.
Okay.
That is compounded at Physician's Preference Pharmacy, and all of our products that are designed for the skin, especially most of them are for the face and also for the neck, but we do have some that are used. Actually, sometimes people use it on the hair or even full body. Not this particular product, but this one is mainly for the face and the neck.
Yes.
But all these products are proprietary. So when we combine these ingredients, we do so for a few different reasons. Obviously, because the combination of these particular ingredients act synergistically, or they work well together to help you achieve that balance within your skin or address symptoms, depending on whatever it is that we're trying to treat or what we are trying to prevent. As always, I always mention that with our products that are compounded at Physician's Preference, because we are a hormone practice, we do not like to put products into our preparations that are hormone disrupting. There are a lot of companies that make the raw ingredient that sells to compounding pharmacies that are chock full of parabens and other hormone disrupting agents that we don't want in there. So just because it's available does not mean that we would use it. We are highly selective around those products, and so that just sets the stage for what we're going to talk about with this particular compound, the healthy skin cream. So although there are a couple other ingredients in it, what we're going to talk about is we're going to focus on azelaic acid, squalane, niacinamide, which is vitamin B3, GHKCU, which is a peptide complex, aloe vera, and then there's some ceramides in there. So we're just going to go through one by one, unless you have a favorite of those ingredients that you want to start on.
Well, I'll combine two just to begin with, because I do have a favorite ingredient. However, sometimes our favorites, they move a little further from the foundation. So the foundation of this product, the squalane and the ceramides, so very important. These are lipids. Our skin barrier, which is not the first thing that we think of when we're using a product. We want it to feel good. Sometimes we want it to smell good. We want to see a result, yesterday. However, our skin barrier, typically, we live in the world, our skin barrier is disrupted. Our environment, our diets, everything, the pH, everything, the water that we drink, everything affects your skin barrier. And this is the first line of defense. Our skin protects everything on the inside of our bodies. So I do like to preach to be intentional about what you do put onto your skin. So the squalane and the ceramides basically mimic what makes up the lipid layer of our skin barrier. When you think ceramides, when you think squalane, you think cushion. We are putting resiliency back into our skin. When you think resilient, think less, more moisture retained, healing your skin barrier. Think plump skin, which we all love. Think cushiony, plump, healthy, not healthy looking skin, but actual healthy skin, because we're balancing our barrier. We're giving back to it what everything takes from it, sometimes even skincare ingredients and products that we use. And but those two are wonderful. So that is something that is naturally, our skin interprets that as being natural to it because that's what part of our barrier is made of lipids. So those are two wonderful ingredients. And we want to maintain moisture and we want to prevent transepidermal water loss.
What is that?
So just whenever water is just completely removed from your skin, that's whenever, you can think crepey, you can think dull, thirsty.
So I
hate to say this, but thirsty skin, it's dryness and dehydration.
It's both.
Yes. Okay. So I do love ceramide and squalane. I kind of put those two together. Those are wonderful.
That's interesting because if someone looked at this list, they would think that those are the least attractive names on this list. Like people aren't familiar with it, right?
Yes.
So that's super interesting. You had made the comment earlier about the dose being right, nothing being too aggressive or too strong or underdosed. So let's talk about the azelaic acid, what that does and why you don't want too much or too little.
Well, with azelaic acid it's a naturally derived acid. It is the most universally, it's universal, but it's universally used in such an array of, not skin types per se, but skin conditions. It is just the smartest acid that you can put in a product because it can be used by so many and for so many things. So azelaic acid acts as an anti-inflammatory in the skin. It will help to regulate or encourage or both cell turnover, but in such a manner that should be natural to your skin per your age and whatnot, because as we age, that cell turnover process does naturally slow down. And it helps with post-inflammatory hyperpigmentation and melasma. And do you know where we notice post-inflammatory hyperpigmentation, melasma, and rosacea, or in our guests who are going through wild hormonal imbalances in their lives? So it is, and then it helps to treat acne-causing bacteria. So it's just the smartest ingredient that could be used in a skincare product. It is one of my go-to safely used skincare ingredients. Because melasma, you can't treat melasma. Even though it's hyperpigmentation, you can't treat it like sun damage.
Well, it wasn't until today that I thought of an acid as smart. So I learned something today. That's super interesting.
I love that one.
Yeah.
It's one of my favorites.
On the topic of ingredients that work smartly and intentionally, I want to highlight the GHK-Cu, which is present in this product. And I'm looking at our list here in front of me of our compounded skincare, and we have a handful of them that the GHK-Cu is present in. So GHK-Cu is a tripeptide copper complex. So it's got the 3 amino acids, which make it be comprised of a peptide. But something that's interesting about or special about GHK-Cu and makes it smart is that it's attached to copper. So the copper being attached helps to drive the peptide into the cell so that it can do its work intracellularly. And when we talk about hormones, sometimes we will apply hormones topically. A lot of times we'll take them internally or orally or sublingually, sometimes through a shot, right? So there's all kinds of different ways that we can get these in. When we apply GHK-Cu topically to the skin, it does help to decrease that superficial redness. It also is a phenomenal anti-inflammatory, which is why we have it present in some of our other products like our hair support solution that goes directly on the scalp to decrease inflammation and redirect blood flow to where it needs to go. So when it's present in some of our products, it helps to visibly give some resolution, which is nice because, again, we are not in the instant gratification business. So when we have something that we can physically see the benefit of is really nice. Anything else you want to say about the GHK-Cu?
You've got
it. All right.
You've got it.
All right. So we also have the niacinamide in there.
Yes.
Talk to us about
that one. And that is a popular, niacinamide and azelaic acid are extremely well known in the skincare industry right now. And a lot of us think, we need those ingredients in every single one of our products. And that's not the case. That's not how I address your skincare routine. However, niacinamide, is a wonderful, it helps to reduce inflammation. It helps to reduce post-inflammatory hyperpigmentation, which has a multitude of cascades in the skin. When you think, pigment, you don't think, there's 14 to 17 different inflammatory cascades happening in the skin, and you have to address all of those in order to see a result. So niacinamide is wonderful for rosacea. It will be in acne products. It helps to reduce all of the inflammation, and it does help to support collagen in the skin. And niacinamide actually also helps your skin barrier to produce those ceramides again. So when you're using it with ceramides and it's already going in to the skin and it's helping you to maintain, the ceramide levels in the skin, that's even better. Yeah. So it's just a nice little miracle you got going on in the cream there.
We have some great before and afters, and so we're going to share that because I think it's important for people to be able to actually see the benefits that we're seeing and actually see what kind of benefits they might be able to have.
And the aloe vera, aloe vera is important as well. I mean, that's high in antioxidant enzymes. That also is just the most ultimate healer. So that's, I don't want to forget about that one too.
No, that's super important too. Usually we think of this as an anti-inflammatory based cream. It's designed for daily use, so applied after you've cleansed your face to clean skin. We've really seen a lot of resolution in our acne folks. In fact, the original request for this was, you've got acne cream and it works really well, but what about the daily support? So this is intended to be used on a daily basis. As Bailie said, it also soothes the skin and serves as a barrier and a moisture locker, right? So you were talking about the ceramides and why it's important to have that in there.
It does help to reduce the moisture loss.
Yes. So this is just part of the approach to healthy skin, and just like any of our other compounds that are available at physician's preference, even our skincare products are only available by prescription because they are made within a compounding pharmacy. So you are just so smart. Isn't she so smart? So thank you for joining me today.
Thank you for having me.
You make skin fun.
Thank you.
You make skin fun. So be sure that you get a hold of us if you have any questions about this particular product, but also you can have a consultation with Bailie. And so she can help you understand your skin as the individual that you are, because we should not be confined to a box with hormones, with skincare, or even with the treatments that you provide too, because you offer those in-office treatments, of course. So please be sure to reach out to Bailie, contact her with questions you have. If you have questions about this cream in particular, of course, you can reach us directly at Physician's Preference Pharmacy at 281-828-9088, and it would certainly be our privilege to serve you. At Physician's Preference Pharmacy, we specialize in compounding bioidentical hormones, which means that all of our hormone medications are made right here on site in our compounding labs. The term bioidentical means that the hormones in the products that you're taking, whether that's in a capsule, a tablet, or a cream form, are chemically identical to those which your body produces. So your body responds the same way it would to its own hormones. This is important because hormones work in the body as a lock and key system. Just like your front door, only one shape of a key will fit the way it should to unlock that door. And the same goes for how hormones work within your body. For a medication to be the most effective, with the least number of side effects, we must give your body something that it recognizes as its own. And this is why we choose bioidentical.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.